The Mojo 2 non-vented mask by Sleepnet is designed to provide optimal respiratory support for acute care patients in a hospital setting. Ensure you have the Mojo 2 non-vented mask, headgear, and any necessary ventilation equipment. Wash your hands thoroughly and ensure the mask and components are clean and ready for use. Use the size guide that comes with the mask to verify the mask is the correct size for the patient. When using the size guide, ensure the patient's mouth is slightly open. Line the top of the guide to the bridge of the nose and select the smallest size that does not restrict the nose or mouth. The appropriate size may be smaller than expected due to the design of the mask. To assemble the mask, lay the headgear flat with the light gray side facing up and the Sleepnet logo facing down. Remove the magnetic clips from the Mojo 2 mask and set them on the table. Thread the longer straps through the magnetic clips, ensuring the magnet faces the same direction as the light gray strap. Then, thread the top 2 straps through the forehead slots. Lastly, reconnect the magnetic clips to the mask. Unhook one or both clips from the mask and place it on your patient's face. Seat the bottom cushion at the crease of the chin. Tip the mask up to contact their nose and reattach the clips. The mask may sit lower on the nose than expected, depending on your patient's facial features. The headgear should lay flat across the back of the head. Ensure that the headgear is centered by aligning the 2 straps. Then, pull the straps back, adjust the strap tension, and affix the tabs. Turn the forehead adjustment dial to adjust the tension until your patient is comfortable. If necessary, readjust the straps for a comfortable fit. Check for any pressure points or discomfort, then adjust as needed. To ensure a proper fit, avoid over-tightening the mask. This will help to prevent skin irritation and sores. The ergonomically designed air gel provides a shelf that folds in when touching the patient's nasal bridge. This reduces pressure on the nasal bridge and prevents over-tightening of the mask, which can lead to skin ulcers. Once adjustments have been made, connect the mask to the ventilator tubing and follow the equipment manufacturer's instructions for use.